Thank you very much, everybody, for coming out tonight. I wanted to give everybody, first of all, an idea about who we are, what we do, and so on. I appreciate the die-hard fans who came up on a cold Tuesday. I appreciate all the real good friends who've been very, very attached to us. And this is actually a whole new approach to our healthcare crisis. You know, if we have a scientific approach, if you would, to the problem. We have so many millions of Americans have no health insurance. We have people who are called self-pay. While we are seeing the debate going with the healthcare reform in Washington between our two parties, and I'm sure everybody have seen the tragic events, for which I'm going to ask everybody to stand up for a moment of silence. So please do so. Thank you. You may be seated. We know that there's so much to be done. Number one, stop the waste. Number two is reach out to a whole new concept of prevention. And that's what we're here to launch as a new, one of its kind, and hopefully start here in Hernando County. 10 years ago, we started Thanksgiving Food Basket program that some of our leaders in the community, they're here and witnessing the birth of that program that has grown, and now it's all over the United States and Canada, all over North America, all over the nation. So we hope to simulate the same experience and replicate that with the healthcare. Anyone basically needs three things in life. You need to eat, you need to be healthy, and you need to be safe. So Brooksville Cardiology is handing out food as much as possible to those who need, and teaching everybody to be healthy, and with bringing people together and learn about each other and understand and be educated in the global world, that will bring peace in your backyard, in the community, and to the whole entire world. So with that, I believe that if you have a diagnosis, first of all, you have to make a diagnosis of the problem. Problem is we have huge expenses, and really, a lot of people don't get nothing. We have 60 million Americans have no food. We have a lot of people who don't get access to health care in the richest nation in the world. That breaks my heart. And although we can sit and talk and complain about things, but that's not going to solve anything. So to bring a remedy or a solution, this is what we propose. While again, they're sorting out the Medicare issue, we cannot, for 65 and above, get that. Although we take care of everything, we do one-stop healthcare, we do internal medicine, cardiology, so no one can be yo-yoed back and forth between the primary care and the subspecialist, and people sometimes in the office, and I have all my staff in the back, they can attest to the daily pain that have to go through authorizations, especially with the HMO. And then first to get on it, and then authorizations, and then we have something new, it's called peer review. It's like customer service. I'm telling people the real medicine that everybody practicing nowadays. And then after you go through the case, I feel like a first-year medical student, going through, my preceptor to let them know what I have and so on and so forth. And then, okay, I'm going to give you a reference number. You ready? I'm going to give you a reference, just like when you have in a bank transaction. And somebody comes in and write it down and so on, and I take it and we do everything by the book, evidence-based medicine, and then comes in later, and then someone will go and tell you, well, I'm sorry, we authorize a test, we passed the indication and so on and so forth, everything's great, but now you do the test and there's no reimbursement. You stick your neck out and you do all this stuff and there's nothing coming. And this trend, unfortunately, is not only happened yesterday, it's been going on for the last 3 years or so. And it's getting to the point where it's incompatible, with continued to give and serve, because you give out all that service and there's nothing coming in. We know Medicare maybe will be in the bankruptcy in about a few years. God knows how long. And we know that the insurance companies, because of issues of fraud and waste and abuse, all the premiums going to go up. Somebody's going to have to pay for this. And we have to work together to reverse that culture and that cycle. All of us, we're going to be victims of it if we don't do something about it eventually. So what's the solution, Doc? You give us all this, introduction. Now, there is a few million Americans, hard-working Americans. They really are suffering. And while they cannot wait for all this back and forth debate in Washington, they need immediate relief. They want it now. And the relief has to come from a good health care delivery that's very, very affordable, that anybody can jump on it. And I'm saying from 30 to 65. And it will save tons of money to the patients, tons of money, to the families. And if we prevent disease processes, which are preventable about 95%, they will not be sick later on. And when they come to Medicare, they'll not be burdened on the government. So we're saving money to the patients, to the families, to the communities, that somebody can invest in business, and also help take the stress away. And later, they will not have so many diseases that require so much costly treatment, and then will kind of burden the system and so on and so forth. So we actually help our national economy, and it starts from each person. So bottom line is called wellness, agreement, or a program that we have, health maintenance and wellness agreement, that this program will basically come to the point, if we make everybody healthy, and that's doable, and regardless of what Bob Penrod said, we can do that, and we can make them stress-free. Now, if I ask anybody, how many people complain of stress every day? 80%, 50%, 60%? What do you think? Bob, how much do you think percentage-wise? How many suffer from stress? They talk about stress. 90%. I can tell you more than 100%, 110%. That's reality. So although I cannot do anything about the economy, I cannot do anything about politics, this and that, we can make an immediate relief to everybody. And I'm going to tell you what we're going to do. So I just want to start off first. For those who know Brooksville Cardiology, this information you can share with your friends, family, neighbors, with a little email. It goes around the globe. So I'm going to give you more details about it, so hopefully you'll be uplifted. First, anyone from the age 30, 65, so that's below Medicare, how to enroll. Very simple. You come to the office, either on Cortez Boulevard, 9 to 10 in the morning, or you go to the Wesley Chapel office if you like shopping at Wiregrass Mall. Anybody who likes the mall over there, we have the office behind Sam's Club. And then you can basically sit down and go over the details. I'm going to just give you a summary. And eventually we'll have it online, so you can go in and enroll online. You don't have to see me or see the staff, and it'll be instant. And we'll have a PayPal system, and you can just enroll and start right on it. You could have a PDF file right then and there. Next. So this is the relief that we're trying to get to everybody. Huge premiums, huge premiums, and people are really not getting much or the money worth. And while there is huge premiums, certainly there's providers who don't get paid. Even if we are approved providers, we are giving the service. We are going by evidence-based medicine. We are only doing the things that's indicated and so on. And still, it's not even make break even, if you would. So where's the solution? Patients are suffering, and providers are suffering, and then the system is like almost going to break. There have to be some sort of intervention to turn this around and bring people hope. We want to restore the dignity of the patient. We want to restore the honor of the medical profession. It is the most honorable thing on earth to actually take care of people. It's a privilege. Anybody who comes to the office, that you trust us to the point that we actually take care of them. And we are very proud in the office, and I'm talking about the staff who really, do a great job, and all the 4 ladies in the back, and you can, we have Melanie, Isabel, and Victoria, and Nina. They're really doing a wonderful job keeping me, straight, and making a very smooth operation. Also, Mrs. Eldine, who's not here because she's helping my kids with the homework. But the whole idea is we want you to know that we actually care about you patients, and it's not really the dollar sign or the money. Everybody knows Brooksville Cardiology. We have been taking care of people who have nothing for 13 years. Hundreds and hundreds and hundreds, and we have 2 Crescent clinics, one in Hernando and one in Tampa. We see all and serve all mankind for nothing, for those who are in devastation. But I'm talking about those who are, yes, they work, yes, they struggle. They don't have to make, call self-pay patient. They don't have these huge premiums. Well, we can give them an immediate relief, and I'll tell you about the package as I go along with it. And keep them healthy and keep them happy and really, really able to fight stress and get up, work, take care of the family, help to pay the bills, and help to be a productive member of the society. Next. So again, the whole thing is what? Give people hope, restore the dignity of the profession, and also the whole entire old-fashioned values. That you go into the doctor to be helped and to be well, so you go back and take care of your family and business and so on. I'm going to ask a question. What's more important, health or wealth? Health. Anybody? Health, everybody. Okay, so it's very important because this is it. And I want you to know that, there are certain things has no money value to it, has no dollar value to it. Trust. Can you go buy $500 trust, in someone, or respect or comfort, confidence that you can be comfortable with X or Y? It's like, I want to go Italian, dining. I want to go to restaurant, Italian restaurant. We're in Palace Grand. Everybody give a big hand to Paisano Nick Sassa over here. This is the best place in town, and we appreciate this. Palace Grand is a very special spot in my heart, and long history. We feel coming to Palace Grand like coming home, basically. So this is a beautiful, warm feeling in the cold winter that you get in Palace Grand. I know that this is not exactly the weekend, and it's cold weather and so on and so forth, and we hope there is another event coming up on February 22nd that will hopefully be standing room only. We wanted to get the word out to everyone so that everyone can benefit from it. Again, it's not for everyone. This is for basically those category that have been ignored and have been really missed and lost in the shovel. So we're going to try to keep everybody away from hospital. Anybody work in the hospital here? You don't like it because, hey, you're taking the business away. Well, if we keep everybody healthy, that's the whole purpose. There are things going to happen. People are going to get sick. Yes, they will have to go to the hospital for one reason or the other, but I think for the most part, this is preventable. And we do. If you do a good job as a doctor, outpatient, no one should go to the hospital, period. Maybe less than 2-3%. And we're the living evidence of that in Brooksville Cardiology, and we're very proud of it. And I don't do miracles. I'm not, like magician or something. I just go by the book. We go into the patient. We actually put an investment in trying to figure out what the patient has and what the patient is complaining of. And here is the medical condition, and here is, the evidence-based medicine that fits this diagnosis, and that's